welcome to Weather HQ. I'm Paolo del Rosario. This week, we've covered a variety of relevant and meaningful issues, from DPWH's flood control initiatives for the wet season to common illnesses during the rainy period. And of course, the Philippine Red Cross encouraging Filipinos to participate in World Blood Donor Day. Now, let's begin with the DPWH's strategies for flood prevention during the rainy season. Here's my interview with the Department of Public Works and Highway Secretary Manuel Bonoan.
Let me start by saying that when this administration, since 2020, middle of 2022 to since then, we have implemented numerous flood control projects all over the country, both on locally funded programs and foreign assisted projects in major river basins all over the country. And this year, once again, since the first quarter of this year, we have already started to implement all the flood control projects that are already included in the budget for 2025. So ongoing pa yung karamihan ngayon, but we are speeding it up so that these flood control projects would be ready in time for the rainy season. No? Well, there are projects kasi na malalaki and big projects that are funded in the major river basins of the country that are still ongoing, but they are being pursued relentlessly for their completion in due time.
Secretary, may mga areas ba na binibigyan ng urgent attention or priorities in terms of resources ng DPWH?
Yes, there are two. We are attacking it in two fronts. Two fronts actually. Yes. One is yung mga immediate locally funded projects to provide immediate relief to low-lying areas. No, I think there are so many areas that are now prone to flooding because of the problem of yung siltation in the main rivers. Over the years, kasi there has not been any concerted effort to desilt and dredge the rivers, so that's why the river beds are very shallow, and these are actually prone to flooding whenever there is a downpour. Now, the other thing is the major river basins, the mga malalaking ilog all over the country. There are 18 major river basins in the country that are now being attended to. One is also in Metro Manila, and like Pampanga, the Visayas and Mindanao as well. All these are being foreign assisted. Ibig sabihin, yung from official development assistance from foreign countries and multilateral lending institutions. So all these are still being pursued for the time being.
Secretary, I want to focus on yung mga highly urbanized areas po natin when it comes to yung drainage systems and flood control projects in respective regions po. Are there any status updates po on whether or not completed or in need to be expedited in time for the heavier part of the rainy season po?
Yeah, I think in urban areas, I think the flood control program being pursued by DPWH is just one of the components to address the flooding areas in urban areas. No? I think it has to be, as the President has been saying, it has to be done holistically and collaboratively with other agencies, including the local government units. Particularly, let's say, for example, in Metro Manila, I think, yes, there is infrastructure program that is now being undertaken along the Pasig Marikina flood river. I mean the river, but internal drainage in Metro Manila has to do with the efforts also of the local government units in terms of yung waste management, mga basura, and yung mga land use programs, yung mga ganon. See, we might have been doing yung mga infrastructure protection works along Pasig Marikina River, but then yung drainage system, kung matindi ang ulan at yung mga basura naman naiipon sa mga inlet, sa mga drainage, then ganoon din, magbabaha rin. So I think this is where the local government units should also participate in addressing the flooding problems in urban areas.
Secretary, you mentioned yung interagency effort na kailangan to address the floodings in different areas, not just in urban areas but then all over the country. When we take a look at yung gaano ka-importante yung interagency efforts in terms of responding to emergency situations po, how important is that partnership, especially when it comes to yung mga quick response po at emergency crews and equipment for really emergency purposes in the upcoming months?
I think we are now collaborating with the other agencies like the Department of Environment and Natural Resources. I think one of the, in the big river basins, we are actually collaboratively doing flood control programs. Kasi yung the watershed management program would have to be taken in conjunction with the DNR's effort also, no? Kasi sila nakakaalam dun sa mga watershed areas. But we have to put also infrastructure in the watershed areas for us to be able to provide the necessary infrastructures to contain muna yung mga flood waters from coming down, and then probably magagamit din for other purposes like irrigation or water supply and things like this. So these are being done already in the big major river basins programs. Ganun din dito sa Metro Manila. For example, in Metro Manila, we are now in the process of looking at the infrastructure requirements dito sa may Sierra Madre watershed area where the flood waters are coming down to Manila, no, to Metro Manila, by building up some dams, reservoirs.
Yes.
Para hindi pumasok agad yung rainwaters or flood waters in Metro Manila during the rainy season. Di ba? Ganon.
Opo, Secretary, when we talk about yung infrastructure po and of course the strategy when it comes to building, it's a long-term view. But when you take a look at yung impact po ng climate change recently, has DPWH adjusted yung pagplano nila in strategizing in terms of the infrastructure that they do plan to put up or are putting up to answer this particular threat?
Yes, of course. This is now a very important aspect in the implementation of flood control infrastructure projects. When before, ang design parameters namin actually that for infrastructure projects, we design them with it's a very technical issue. But ang sabi namin is yung return period, flood return period, ang ginagamit lang namin noon is either 15 to 20 years, no? Yung return period design requirements. Now, because of the climate change phenomenon, I think we have adjusted it either 50 years return period, and in some major river basins even 100-year return period na yung ginagamit namin. So that these are the things that we are actually now considering in the implementation of the flood control programs that we are undertaking because of the climate change phenomenon.
Sir, when it comes to mga projects, when it comes to addressing climate change, what are the partnerships na napaka-importante po to work alongside the agencies you have to work alongside to make sure na science-based, data-based po ang decision-making po ninyo?
Absolutely, yes. Yes, of course, this is now the technical paradigm that we are actually using for the flood control programs now in addressing the flood problems in many areas of the country now.
Coming up next, an in-depth look at the most common rainy season illnesses. Weather HQ will return. Hello there and welcome back. You're watching Weather HQ. I'm Paolo del Rosario. With the arrival of the rainy season in the Philippines comes a surge in health threats due to infectious diseases. Now, to help us understand these diseases better, here's my interview with Dr. Rotjean Solante, the head of the Adult Infectious Diseases and Tropical Medicine section at the San Lazaro Hospital.
There are infections that are that will increase in times like rainy season, because these are what we call tropical infections, which means that the environment will play an important role in terms of the carrier of this infection. Like, for example, dengue. Why dengue will be much more higher during rainy season? It's because of the ability of this mosquito to populate more, to copulate more, and they are a lot of them during this time of rainy season. They thrive in waters, especially standing waters, and in highly urbanized population like Metro Manila. We always hear that during rainy season there is an outbreak or increase in the number of dengue, because the mosquito carrying the virus will also be higher in terms of density and number. So that's the risk of exposure of people for dengue will be higher. I think the other one that we have to be watchful is, again, leptospirosis, because last year we had one of the highest number of leptospirosis over several years now, if compared to the previous typhoons. And leptospirosis comes also with a very high mortality, especially among our population, the younger population who are outside working and exposed to this flooded waters.
Doc, when we talk about, I want to focus on dengue first and foremost, because earlier in the year, we were able to actually see a spike in dengue when it was not the rainy season. From a standpoint of a healthcare practitioner po, especially looking at what we saw as a trend of a sudden increase at the start of the year, what are we expecting in terms of dengue cases in the rainy season? Do we expect something a bit more, or are we more guarded right now? Kasi sa start of the year, medyo tumaas nga yung number of dengue cases in a time frame that we did not expect it to rise.
Well, if you look at the trend in terms of epidemiologic surveillance and trends of dengue cases, even if we do a lot of these preventive measures advocated by the Department of Health, cannot prevent the increase in the cases, especially during the rainy season, because of our environment, because of a lot of the factors that are being considered there. Dumadami ang ulan, tumataas ang risk ng mga areas na flooded, And at the same time, yung mga basura, you'll notice, pag umuulan, ang mga basura talaga hindi din makontrol natin. These are things na talagang it's really in the environment, why the rain can be the factor there that ang cases natin, ang dengue, mataas talaga.
When we talk about trends, you mentioned it po. Let's look at it from a year-to-year basis. Has there been any improvement in the way that in the numbers of infectious diseases that San Lazaro Hospital in particular has experienced throughout the years? Has there been any trends in a good or a bad way throughout the recent years in terms of the rainy months?
Well, that's a very good question, because in fact, when we look at trends every year in terms specifically for dengue, talagang wala, hindi natin nakikita yung nag-improve tayo with regards to control of dengue, and that's why one of the reasons that we always advocate that hopefully our country will detach ourselves to just an environmental part of controlling dengue, but also implement or include vaccine, because I think for people who are also highly vulnerable, like children, the elderly population, And even we see some healthy people or individual with dengue still die because of the virulence of the dengue virus. I think that's another option that we can have in terms of how we can really control and lower the mortality of dengue.
Leptospirosis, yun na-mention nyo rin po kanina, it is a big concern when it comes to the season. A lot of it is environmentally related. Some people, nakita natin the trend nga kapag bumabaha, may talagang nagsiswimming sa flood and they have fun with it. When you take a look at the symptoms of the people should watch out for, especially yung early symptoms po, how can we identify leptospirosis early on?
Yes. Most of this infection, no, hindi lang leptospirosis, even dengue, the most common symptom is fever. Okay? So, have 2 to 3 days of fever. Specifically for leptospirosis, ang tandaan natin, pag halimbawa lumusog ka sa baha, no, after 3 to 5 days of that, you will already have the first symptoms of fever, panakit ng katawan, no, masakit yung paa, and then namumula yung mata, no, we call that conjunctival suffusion. And then yung pinaka-importanteng sintomas that we need to be aware sa mga na exposed sa baha. Pag yung lagnat mo, tapos kumukonti na yung ihi mo, that means that your kidney, no, o yung bato mo, apektado na rin, no? So you need to go to the hospital because our experience, a lot of these people or patients, they still go to work kasi ito yung mga workforce na kadalasan ang affected dito, yung mga motorcycle driver na nagde-deliver ng food or whatever is that. That's one of the most common patients that we have, no, yung mga drivers,
Yeah.
yung mga naglalakad sa kalye, nagbebenta ng mga ano-anong binibenta. These really are the vulnerable, no. So kadalasan sa kanila pag may lagnat, okay lang, no, hindi pumupunta sa doktor. Doon na lang sila pumupunta pag wala na silang ihi 2 to 3 days after. And it's so hard to control and treat them because at that point in time, apektado na yung bato nila. Meron na silang tinatawag na severe renal failure. Kailangan na silang ma-dialysis. And sometimes this patient will really not survive long.
Doc, we're running out of time, but then before we let you go, let's try something special here. Let's try to lower yung numbers po ninyo when it comes to dengue cases and leptospirosis cases by giving some advice po of how people should act as we enter the peak of the rainy season, as we are starting to see more and more rains entering the country. What word of advice can you give moving forward to prevent dengue, leptospirosis, and all of the other diseases that do come along with the season?
Okay, so for dengue, no, importante sa dengue, maglinis ng kapaligiran natin. Huwag mag-imbak ng tubig, yung mga tubig na kung saan namumugad yung lamok. Pag merong sintomas sa first, second, or third day of fever, huwag patagalin, pupunta sa doktor para masuri, matest. May mga available test na tayo ngayon sa dengue. For leptospirosis, as much as possible, huwag lumusong sa baha, no, or sa tubig, no. But in the event hindi mo mapigilan yan, if you had that chance to go to the center, there is what we call leptospirosis antibiotic prophylaxis. Iinumin mo yan, bibigay yan sa doktor sa center para hindi mag-develop ng leptospirosis. Pero pag nag-develop ng symptoms na after wading sa baha, please go to the hospital early para meron pa tayong magagawa because these are all treatable, no? So ang point ko lang dito, pag may mga sintomas na huwag patagalin, 3 to 4 days, may lagnat, masakit ang katawan, magpatingin na because a lot of times we can still do something na hindi tayo magiging mamamatay sa mga sakit na ito.
Up next, let's take a look at what the Philippine Red Cross has planned for World Blood Donor Day. Stay with us. You're still here on Weather HQ. Welcome back. You're still watching Weather HQ. I'm Paolo del Rosario. The theme for this year's World Blood Donor Day is Give Blood, Give Hope, Together Save Lives, emphasizing how every blood donation can make a difference. Now, to discuss this initiative and how Filipinos can lend a hand, I spoke with Philippine Red Cross Secretary General Miss Gwen Pan.
World Blood Donor Day is being observed annually every June 14. So it serves as a awareness raising for the public about the need for blood donations, and to also celebrate the efforts of our voluntary blood donors who we owe so much, because they have given so much of themselves for others may live. So this observation is critical globally as it emphasizes the importance of blood donation in saving lives and improving health of the people who are in need of blood. Now, in the Philippines, as you have asked, do we have enough blood supply? No. So the WHO, or the World Health Organization, the formula of targeting how much blood do we need per country is 1% of the population. So now if we have about 112 million, 215 million population in the country, so that would mean that we need about 1.1 million bags of blood. Philippine Red Cross, as of last year, we have collected over 550,000 bags of blood and benefited over 300,000 patients nationwide. No, it means that this makes the Philippine Red Cross as the almost, the main blood source in the country, majority blood source in the country, as a single organization. And the rest of the blood, they come from private hospitals and also our government hospitals. So do we have enough blood? Well, as far as the Philippine Red Cross is concerned, we're trying our best to really supply the blood demand for the country. So, but since we don't have the statistics or data of the entire country as of today, we only have Philippine Red Cross data. So far, we still receive a lot of requests. We receive a lot of requests every day.
Yeah.
And then there are rare blood types that we have to search every day. Dumadami. They're even becoming more and more demand for Rh negative blood type. No, so we have two blood categories. No, we have Rh negative and Rh positive. Both have A, B, and O types.
Yeah.
So the rarest in the Philippines, actually, the Rh negative blood types. These are most likely are blood types of foreigners, especially Caucasians or of European, Europeans, no. But every day we have been receiving requests for Rh negative blood now.
Really?
It means maybe dumadami na rin ng Rh negative people who have Rh negative blood type in the country, and this is so difficult to find because we only have less than 1% of the population in the Philippines who has Rh negative blood types.
Oh, that's so interesting.
We still need that, and then of course, whoever's listening and whoever would like to help us campaign for this, we're campaigning to build the roster of our Rh negative blood donors in the country so that we can easily access them in case there's a need for blood. And normally we don't bleed, we don't take blood from the Rh negative donors because we reserve that when when the time will come that we need the blood, because for a conventional way of giving blood, we can only extract once every 3 months from donor. Yeah.
Wow, that is very interesting. Rh negative in particular. You issued the call just now for those Rh negative to be put in the roster. How do they go through that process? And of course, for those who are not Rh negative but do want to give blood, what process can they go through? And of course, what activities do you have to get people into volunteer?
First, they can actually call our hotline 143 to give us the details that they are Rh negative blood type, and then we put them in our roster. Or number two, they can also go to the nearest Red Cross office in their area. By the way, Paolo, also with dengue cases arising, especially during rainy seasons, blood demand is even more higher, especially for platelet blood components. It is also the same with the patients with having cancer conditions. We are also receiving a lot of requests for patients who are in need of blood that are diagnosed of having cancer, like blood cancers. So we also continue to give them blood, and also those patients who have kidney diseases that need to undergo regular dialysis procedures. So these are, it depends on the season, depends on the situation, but we always in need of blood. And, with the increase in population, increase in the also technology, in the medical sciences, all the more we are seeing the increased need of blood.
Before I move on to talking about the strategy of getting more people in to donate, I want to ask about the health screening process, because not everyone could be donors because of X or Y factors. Can you tell us a bit more about the screening process to ensure that the blood donated is safe and, of course, usable for those who really need it?
Yes. So, well, what's the process that you have to undertake? Number one, we help prepare the blood donors, who will come for blood donation drive or on their regular blood donation day. So, what we have to remind them is, number one, they have to have the age. It must be they must be 18 to 60 years old or 18 to 65 years old. 18 to 60 years old if they're not a regular blood donor, but 18 to 65 years old if they give blood regularly. That means that it's 3 to 4 times a year that they give blood, or every quarter. So then they qualify to reach until age of 65 years old. Now, can 16 years old give blood? Yes, provided they have parents' consent. So if they have parents' consent, then they can come and give blood. And for minor age group of 16, you can already give blood for 16 years old. Then, of course, you have to have enough sleep, at least 5 hours. No alcohol drinks, or you have not taken any alcoholic drinks, the day before the donation. And then you have, you can donate even if you're hypertensive or if you have diabetes, provided on that day of donation, your diabetes and hypertension is actually controlled. So if it's controlled, then you can actually give blood. But for dialysis, for patient with diabetes, if you're already taking insulin, we cannot take blood from you unless kung medication lang, it's okay. And then also before donation, avoid heavy meals.
Yeah.
And then or oily meals. And then that's all. And then the weight, it should be at least 110 pounds for Filipinos. So that is the requirement, So the whole process is very easy. So it's actually almost free checkup for those blood or blood donors, diba? So when they come, we check their health condition. So because only healthy individuals can donate blood. So we check them physically, and then we also have questionnaires for them to answer. We weigh them, we check their hemoglobin, if they can give blood on that day. So hemoglobin is very important because that measures also if you have enough oxygen in your blood and that hindi ka puyat. So if we check on your hemoglobin, if it will not float, it's heavy, it will sink, to the bottom of the testing jar that we're using, then you're okay. So that's the only thing. And then you get a free medical checkup. So, and then if in the event, you are tested positive on any of the 5 transmittable diseases, we will notify you. And these are all confidential, these are all handled very, sensitive
discreetly.
and careful.
Yeah. And that's a wrap for this week on Weather HQ. I'm Paolo del Rosario. Thank you so much for watching. Join us again next week right here on BNC, the Bilyonaryo News Channel. Have a great weekend.